Hi, this is Dr. Durek Nur Hassan, practicing reproductive endocrinologist and infertility specialist here in the Dallas-Fort Worth area, as well as author of Miracle Baby, A Fertility Doctor's Fight for Motherhood, and the Fertility Manual, Reproductive Options for Your Family. Here today to talk to you about fertility treatments in the LGBTQ population as part of Pride Month. Infertility affects everyone. It does not matter our race, religion, socioeconomic status, and/or sexual orientation. As our country continues to work on becoming a more inclusive environment, I would like to discuss fertility options in the LGBTQ population. For same-sex female couples, donor sperm is a great option. There are many reputable cryobanks in the country where donor sperm can be purchased. Cryobanks are locations where human cells and tissues are stored. Same-sex female couples can purchase the sperm directly from the cryobank and have the sperm sample shipped to their home for at-home insemination or shipped to a clinic of their choice for insemination by a medical provider. When done in a clinic, an intrauterine insemination is performed, also called an artificial insemination. This involves a speculum exam where the sperm is placed directly into the uterine cavity. By placing the sperm directly into the cavity, we've bypassed the cervical mucus, where many times the sperm can get trapped here. And also by placing it directly into the cavity, we have now shortened the distance that the sperm needs to swim to the egg. For some same-sex female couples, inseminations may not be the best option, and this includes couples where the fallopian tubes are blocked and/or there's a lower quantity or quality of eggs in the female. In both of these scenarios, in vitro fertilization, IVF, is a better option to help them get pregnant. IVF involves the female taking injections to make her ovaries produce the eggs. The eggs are then retrieved through the vagina and fertilized with the donor sperm in the lab. The embryos are now created and will grow in the incubator until the blastocyst stage. At that stage, they can be frozen. Some couples have asked us to do pre-implantation genetic testing, aneuploidy screening of the embryos prior to freezing the embryos. Pre-implantation genetic testing, aneuploidy screening, PGTA, involves analyzing the embryos to see if they're a euploid embryo. A euploid embryo has the correct number of chromosomes and/or gene regions, and therefore has a higher chance of resulting in a pregnancy and a lower chance of a miscarriage. An aneuploid embryo has an incorrect number of chromosomes and/or gene regions, and therefore has a lower chance of resulting in a pregnancy and a higher chance of resulting in a miscarriage. Some couples may be interested in what's called reciprocal IVF. This involves one female partner being the donor and utilizing her eggs to create the embryos with donor sperm, and the other female partner serving as the recipient and therefore carrying the pregnancy to term. For same-sex male couples, options include donor egg and gestational carrier. Donor eggs can be a known or anonymous. A known donor is typically a younger sister or friend that's donating their eggs. Many same-sex male couples will end up using anonymous donors. There are agencies and cryobanks that can help you find a donor. Additionally, your IVF clinic can help facilitate with finding donor eggs. Similarly, for gestational carriers, there are agencies that can help you find a gestational carrier. There are also independent online groups where gestational carriers and the same-sex male couples can connect and start a relationship in terms of proceeding with a pregnancy. For transgender hopeful parents, options include freezing eggs, sperm, and embryos prior to transitioning, or utilizing donor eggs, donor sperm, and/or a gestational carrier. Another option would be achieving pregnancy prior to gender affirmation surgery. I discuss many more details about fertility treatments in my book, The Fertility Manual: Reproductive Options for Your Family. To learn more about me or my books, please visit my website, www.noorhasan.com. Please like and subscribe to my channel to learn more about fertility.